Well, how long would I have to wait before I could undergo further surgery?
Oh, assuming you're in one of those 2 to 3% that needs to be improved, I'm typically ask patients to wait at least 6 months, preferably a year. The average procedure that I do after a rhinoplasty, or average thing that I see after a rhinoplasty that needs to be tweaked, is getting the ventrum, this is called the ventrum of the nose, as perfect as possible. That is more difficult than people can imagine because the skin thickness from the tip of the nose up to what we call the rhinion and then up to this part of the nose changes. It's thicker here, thinner here, and thicker there. So you're dealing with variable skin thickness. You're dealing with variable structures underneath. You have cartilage here, bone here. And the final problem that we have to deal with, we rhinoplasty surgeons, is the fact that the nose has a growth center called the rhinion, where the bone and cartilage come together, and when we're younger, that's where all the growth occurs. Well, that growth center does not die when we reach maturity. It just becomes quiescent, or goes to sleep. Well, what can you do to wake that up? Well, you traumatize it, and surgery is just another form of controlled trauma. That's the most common thing that I see, is somebody that will look good post-op for the first month or two, and then the nose will try to regrow a little cartilage and bone right there at the rhinion. And like I said, it's not that common. I probably go back and file down 3 to 5 patients a year that have that problem, and that's done on the local and takes me 5–10 minutes. It's a pretty simple thing to address. The other thing, that I don't consider this to be a complication at all, but the other thing that I deal with after a rhinoplasty is the shape of the nostrils. Nostril surgery is always delayed in my practice. The reason being that you cannot revise that. You can't take it back. When you change the shape of the nostrils of course are these structures here. When I take those in or reshape them in any way, that's a one-way deal. You can't take it back. And when I change the structure of the nose, it is going to affect somewhat the shape of the nostrils. In what way, I can only guess. I can't predict. So I don't want to be operating on something that I can't predict that's irreversible. So if I do nostril surgery, that's almost always done 3 months after the rhinoplasty, done under straight local. There's no bruising, no swelling. It's a pretty simple procedure for the patient. It's a picky little procedure for me, but for the patient it's very, very easy to go through. So those are the issues that we typically see.